Good afternoon, everybody. Welcome to today's webinar. We are looking at the long-term condition annual recall system for SystmOne, and we're going to have a little walkthrough of this today. So it is 1 o'clock, so I'd probably go straight into it. I mean, I'll do a bit of a preamble here just to make sure other people join, because as with every webinar, people realize it's 1 o'clock, they see it started and they start joining. So but I will kind of launch into it straight away. So my name's Nathan. A lot of you probably know who I am already. I know we did like an overview webinar a couple of weeks ago. So yeah, we're just looking at the actual SystmOne kind of recall process. So obviously I'm the training specialist lead for Ardens. I've just got a couple of my colleagues on the call as well. So we've got Nicola, who's a fellow training specialist, and we've got Stuart, who is one of the senior developers who does a lot of the developing in the background. So they will be on this with me. I'm obviously doing the presenting, but they are on this just to answer any like questions and manning that Q&A that you're aware of. But yeah, we're just going to be going through the LTC process. To be honest, and it will make more sense in a minute, a lot of you might be using the recall system already. That, you know, I'm just going to go through some of the updates that we've done to it, but you'll probably notice the workflow and everything is very, very simple. There's from an end, we've done a lot of stuff in the background, but from an end user point of view, it should just be a bit slicker and easier, but it shouldn't be much different to what you're currently doing. So it's no major change. You'll probably look at it and go, oh yeah, it makes sense, I'm kind of doing this already, and I can see, you know, just a couple of enhancements. So there's no drastic change on our side here. But anyway, let's get having a look then. So just my usual webinar housekeeping, probably used to this by now, but as you all know, because it's one of these bigger webinars, your microphones are disabled, so we won't be able to hear you, and we will basically be able to, I'm just going to close that because that is annoying. Basically, if you have any questions on that, use the Q&A at the top. So where you've got Q&A at the top, click on that, and that's where Nicola and Stuart will be, just to answer anything that you have. I don't tend to keep an eye on that because it does distract me, and I'll start reading everyone's and then I probably won't, and I won't focus on what I'm actually meant to show. So they'll be manning that. We do provide the Q&A and answers everything at the end. So, you know, as you can see, this is recorded as well. So if you have to dip out or anything, then don't worry, we will send you all the recording and it will be available on our recorded webinars page, and basically you'll be able to watch that at any point, and we'll email that out to you with the slides and support articles. And what we tend to do is, because sometimes the Q&A can go on at the end, you know, if your question doesn't get answered, we'll make sure we answer it afterwards, and we will send out that Q&A to you, so please don't worry. We do say as well, with regards to some of the Q&A stuff, that I'm sure Stuart and Nicola will tell you, like, do email the support desk as well, because some things are easier to be answered outside of a chat or a Q&A on a webinar, and better conversed on an email. So, you know, if we tell you that, it might be an easy way of doing it, but I'm hoping it will all make sense anyway. But yeah, they'll be manning that Q&A for you. At the end, I will talk about training as well, so there'll be a link and emails, because a lot of these sorts of things, you know, we're going to be doing this webinar every couple of months, so you can join at any point, you know, if you need a refresh. And if you want individual training for your practices, training is free. Use us. You know, you'll get more out of that because you'll be able to ask specific questions for your practice. So please don't worry. You know, if you've got something very nuanced, then we don't, you know, if it's easy, you know, book that training in and we can talk about that. You know, that's our job. So today's more of an overview, so you get an idea of everything. And yeah, it should take about an hour, hopefully. And yeah, that's kind of like the housekeeping really, but standard stuff. So what are we going to be looking at? So going to have a quick reminder of kind of what's changing. It's not much, to be honest. Well, there's some really good changes, but there's nothing drastic. So, you know, from your point of view, you'll be still going to the same places and things, like the workflow won't be that different for you if you're already using our system. For those of you that aren't, then this will just be an introduction to this process anyway. But I'll just talk about what has actually changed, and then I'll just kind of go through the process. You know, kind of my standard. If you've ever had LTC training with me or one of my colleagues before, it will be very similar. So, but obviously just show you a couple of the extra bits in there. And then just to kind of talk about kind of next steps, like how you can get support and training, like I said. So there'll be links to that at the end as well. So that's what we're going to do. So what's changing? So on the SystmOne side of things for the LTC, the main change, you'll probably noticed already that the search, kind of all the reports that we've built for you, they are in the same folders. We've done a few renames, so we've structured it. The structure is very similar. We've added some extra reports in there to help you, and we've renamed it with that whole kind of plan, notify kind of tag, which I'll talk about in a minute. But some of those reports are very similar to kind of what was done before. We've obviously made tweaks in the background, but for you as end users, it shouldn't be much different. And I'll just highlight what has changed there. But we've just standardized it just to make it easy for you to use. We do have a new template that you wouldn't have seen yet, and I'm going to show you the new template. Again, how you get to that and things will be very the same as what you've currently done if you're using it. I appreciate some of you might not be using this yet, so again, how you get to it, but for those of you that are using it, you'll probably find how you get to it is no different, but hopefully the template you'll find a bit slicker, easier to use, and a bit clearer. But it will look familiar. It's just enhancements, really. So that will help you with kind of like your data capture and decision support, and just make everything kind of nicer. And obviously we're doing this we're just trying to streamline this and kind of make everything kind of a bit slicker and incorporating all that best practice and kind of doing everything as best as you can. So but as I say, the process, when you look at it, you'd be like, oh, it's I'm used to this, it all makes sense. So the process then, so this is kind of what we always did anyway, but we've kind of structured it in a way, and again, like we covered in the big overview webinar, we've renamed the folders, and you'll see that in a minute. And it's that whole idea of kind of doing like that a journey, if you like. So where I'm going to get to the next page, so where you've got your planning, so a management team might be looking at, okay, what patients are we calling in for their recalls, who do we have to make available for this, have we got enough appointments available? So we got that kind of plan section to make sure that you're prepared before you send your invites out. We've then got the standard invites, which is part of that notify section. That hasn't really changed, really, that you'll be used to doing that. It is just using our reports, that admin might use, or whoever your member of staff is, to do those invites. And then we move on to that kind of assess and review. So again, we've always said this with the LTC process, that assess stage is, we've kind of designed this around you send that invite out, and then you essentially have that kind of initial assessment. It's not a review, it's like an assessment where you do screening, you collect data, you do your bloods, and you do all that in one go, no matter how many conditions a patient has. And that again would be done, and that's that assess stage. And then off the back of that, and again this will all make sense on the templates, once that's done, a few days later, someone can then review the notes, decide what needs to be done next, and then depending on what's going on with the patient, call them in, or send them a text to say everything's fine. Again, everyone works differently, but the process will allow you to kind of do that in a nice slick manner. And in essence, what we're trying to do is trying to get, if you get everything done in that initial assessment that you can do, then that review stage, there should be kind of less that you have to do. It's like, let's just check everything's been done, follow up a few things that are missing. And I guess the whole idea of this is, if you do it in that style, you're reducing that amount of time the patient comes in, you're making it kind of like a slicker process where you're doing kind of everything in one go, and you're not recalling people at different times for different conditions. Again, I know you all work slightly differently, so please don't worry about kind of, there might be things that as a practice, well, we do this and that can all be incorporated into it. So again, it's whatever you, however you work, but it should hopefully make sense for you. So, and then you've got that evaluate stage. So the evaluate where, you can kind of review, okay, what's been done, we can monitor our progress, how many reviews have we done, and look at your dashboards and things like that. So it's kind of like a whole process, but very similar to kind of what you used to, really. So moving on then. So I'm not gonna spend too long in the system because I don't want you to kind of be worrying about loads of slides. But taking a step back, our recall process, what we've basically done, and again, if you did the overview session, you'll be aware of this, we've essentially built a report that says any patient with any condition, and we've put it into one report, and then we've essentially divided it by 12, which is their month of birth. Rather than you having to run separate reports for your asthma patients and your diabetes patients and this and that and doing it like that, you can just do it as one kind of whole, report and do it by kind of, we say birth month, but you can choose another month as well. But we, by default, it's going to be their birth month. So in that essence, think of it like that. But what we do, and again, you're probably used to this already, we give you an option of inviting for 2 different types of conditions. So you can either choose to invite for any patient at your practice that has a cough condition and just cough, which is just your cough registers basically. But as we know, cough changes every year and it doesn't incorporate everything that you'd ever really do a review for. So, things like cancers dropped off of the cough and that sort of thing. So it would only be your cough conditions. Or you could choose to do your cough conditions and your best practice conditions. And in essence, that is kind of everything. It's like your gold standard. It's everything you'd ever invite anyone in for. And as you can see on my screen, and this is all available on our support pages, and you can see this on the reports and stuff, and we will send you out these slides. So please don't worry if you, you don't have to write this down, essentially, is what I'm trying to say. But, from here, you can basically have an idea, of all those conditions. And, we split them up. So you kind of got your, cardiovascular, renal and kind of metabolic ones. You've got respiratory, mental health, MSK, etc. So it kind of goes through like that. Now, there's just a few things. So basically everything on the screen is kind of like your best practice and your coughs. Just a couple of nuances, and again, I mentioned this before, and this is all on our sport articles and everything. If you were just doing your cough conditions, something like asthma, that would just be your asthma register. Now, there is a slight nuance in the asthma register in that that's anyone over a certain age, I think it's over 5, who has had an inhaler issued to them in the last year. So if you just chose to invite for cough patients only, that would basically only invite patients that are currently on the asthma cough register. If you chose cough and best practice, there's a slight nuance with this one, and that's why I like to highlight it. It would basically invite any patient that has a diagnosis of asthma, regardless of if they have had an inhaler issued to them in the last year. So in essence, those patients still have asthma. They've got a current diagnosis of asthma, that there's no asthma resolve code or anything. They just haven't had their inhaler issued to them in the last year. Because it might be that their asthma's okay, they don't really use their inhaler much, they've not had any need to contact you to get a new one. They still have asthma, so in theory they probably do need a review at some point. I appreciate some of these patients might just not have been coded that their asthma's gone because they've never been reviewed, and it might have been 5 years ago they were diagnosed and no one's done anything since. So they would get pulled through. We do have reports to help you with that, so please don't worry, you're not just going to blindly invite them in. But I think the idea is, it's kind of best practice that at some point those patients probably do need to be reviewed and then decide, do they still have asthma? Let's get them off the register, by adding the asthma resolve code or something like that. So it's just a little nuance that I like to highlight, because if you did choose the cough and best practice, you might find that you've got a couple of patients that you've invited in that you might not have before. As I say, we have reports to help you with that, so please don't worry, you're not going to blindly do that, and I will show you where those are. And again, when I talk about training at the end, that's the sort of thing we can help you with as well. So yeah. So anyway, those are the conditions. And then one other thing which is kind of integral to this whole process is we're not using recalls in SystmOne for this, we're using codes. And we put these in again. These will be provided for you, these slides, and these are all on the support articles. But all of our reports, and I'll show you the reports in a minute when I go into the system. All of our reports are basically looking at certain codes that might be recorded. So at the start of the year, where we are now, what you would be doing is you'd be looking at all your patients who have an April recall month, who have one of those conditions I was just talking about. And as long as they don't have one of those codes you can see on the screen now, they will be sat in your first invites. And I will show you this process in a minute, so please don't worry. So if they've not had the invite code added to them, they will be sat there waiting to be invited. There is a code you can add to remove them from the invites for whatever reason. I'll talk about that in a minute, but in theory, you might not want to invite certain patients because you might deal with them elsewhere by another mechanism. So there is something you can add to their notes, which is that code there, which would remove them from our invite searches. So also if they've got that code, they won't be sat there on the invites. And then there's two codes, and these will make sense when I go through the template. And one is the code of chronic disease initial assessment. And that is the code that the HCA or whoever does those bloods, once they come in for their initial review, they would add that code. And if that code gets added, that would remove them from the invite searches because they've come in basically. And then the final code you would add once everything's been completed is the chronic disease management annual review completed code. Again, it's very easy to add these on the template. I'll show you where you do this. You don't have to worry about remembering these for now, but it's just more to get your heads around that's what this process is basically working off. It's the invite code and it's the assessment and review codes basically. And if those codes are added, then they're going to get removed from your invites. It will make sense when I go through it, but I just wanted to take that step back and show you what those codes are now. So I think I'm going to dive into the system. Yeah, so I'm going to dive into SystmOne now and actually show you what these look like. And we're going to start with those reports and where they live. If you've done this before, you'll be pretty au fait with this already, to be honest, but it's good to have that kind of reminder. So what we want to do is we want to go up to reporting and we want to go to clinical reporting. And in here, we should be able to find our Ardens Limited folder. So as you're probably aware, you can open up. So this is you'll be used to this screen. You'll have your own reports. You'll have local reports, but you will all have access to the Ardens Limited folder in here. So I'm going to open that up. And then we've got A to Z. Now for this today, we don't need to worry about any of these folders other than I'm going to scroll down and you will see we've got these LTC review folders and you'll see there we've got LTC review. And if you notice, we've got QOF, IAF best practice, annual. So that's new. We've separated out some interim reports, which used to be included in the folder. And I'll talk about that when we get to it. So there's two separate ones, but we're going to focus on the annual one because I think that's the other thing to say. This whole process is designed for their annual reviews. Not, we have got things to help you with their interim reviews, but this is for their annual review. It's the yearly checking on all those conditions. So that's why we've done it like that. So we've got their QOF, IAF best practice annual, and then you've got one here which is literally LTC review QOF, IAF. So as we said at the start, you get given a choice. The best practice in QOF or just the QOF. Basically, whatever you decide as a practice, you just go to that folder and you can ignore the other one. The process is the same. In theory, all one folder is doing is inviting more patients than the other one. Everything else is the same. So I'm going to show you the QOF and best practice reports. If you decided as a practice just to do the QOF ones, please don't worry. The process I'm about to show you will be exactly the same. So let's open up the this folder here. So we're going to click on the arrow to the left. And now it's kind of no different. If you're already using this, there's not that much of a change. There's some extra subfolders. And you'll notice we've labeled everything with that whole plan, notify, assess, review, evaluate kind of stage. So you can see, it structures it in a better way, basically. But you'll find a lot of those are kind of the same as what you're used to. We've just, done it in a clearer order. So starting with that whole plan phase, we're who are we inviting for, what patients are there, but that planning before you do your invites, you've got these kind of subfolders that will help you with that. So the first one, plan conditions, says what it does. It's basically all of the reports to show you what conditions those patients, what conditions are we calling in for. It was that screen I showed you on the slide earlier. It's all of those conditions, but you can see how many patients fall into it. So you'll notice the top one there is basically all of those reports lumped together. So we got an idea of the total number of patients that in theory I would be inviting in for over the course of the year. But we've then divided them up. So we've grouped them. So you've got those cardiovascular, renal and metabolic conditions. You could run that one and it would show you how many patients would fall into that. Or you can go into, atrial patients with a code of atrial fibrillation or diabetes or heart failure or hypertension. It's your registers basically, so you can see who falls into what. So you could use this to see, are there certain patients on these registers, how many have that condition. You can use it however you want, but you can use that as your guide. So that is all that is, and it's just to remind yourself, what are we calling in for. So that's your conditions subfolder. Nice and easy, really. For those of you that are using the LTC already, this is a new subfolder. So we've got one now called exceptions. And if you remember on that slide, that default from follow-up code, that is the code that you can add to any patient and I'll show you how you can do it in a patient, to say that, you might have a cohort of patients where you're like, I don't want to invite these patients in using this system because I do it elsewhere. You can do that, and if you add that default from follow-up code to any patient you don't want to invite in, they will be removed from the invite reports. That is per fiscal year, so you will have to do that at the start of every year. So it will everything resets on the 1st of April. So just be aware of that. And what this report does, says what it does on tin. Chronic disease default from follow-up this fiscal year, so you can see how many patients have had that code added to them, so who's not been invited in for their invites. So simple as that. So you can see who's got that. So that's a new report, but that should make it easy for you to decide or see who has had that code added. The next kind of plan phase, we've got a recall month subfolder. So as I said, by default, these reports, and when we get to the invites, which is where you're going to be doing most of the stuff, this is just kind of the preamble, really, the plan. These will show you how many patients drop into each month that you're going to recall them for. So for example, April all, but then, so that would basically say, look, I've got 534 patients that would in theory be invited in April, and then you've got May, June, etc. So that's all it's doing, but you could use those to plan ahead, what month, and weirdly, we've got more patients there in March than any other month, which is very annoying because it's the end of the QOF year. So we might want to do something about that and maybe move them to another month. And I'll tell you how to do that in a bit. So you can use it, just plan ahead. What you will notice though on each one is we've got, if I got one there, so March, there's 593. 592 of them, that's their birth month, but you'll notice it says chosen month, and I've got one patient in there. There is a mechanism, and I'll show you on the patient record how to do this, that you can add a code to a patient record to move them to another month, to call them in. So those patients, I could add a code and I could move them to, I don't know, the September reports. So by adding the code, they would then drop into that report and they would be called in September. So those reports will show you how many of those patients you've done that to, basically. Again, I'll show you in the patient record how to do that, but it's just a really easy way of kind of being able to do that. And you can manage that how you want. I think when we did the national thing, we had some practices who have students, so they're not there in the summer. So what they would do is they would move any patients born in the summer to a month where they know they're at uni, and they can call them in then. So there's lots of different ways why you might use that. And again, I'll show you in the patient record, and it's all on the support articles as well, but it's just know that you can do that. I think this next subfolder, the plan review before that I've gone to now, these are really good to run. You can run them at the start of the year, but you can run them throughout the year. Again, we'll have a support article that will explain what all of these do. These are basically telling you they're things to look at before you send your invites out. So, for example, the one I've highlighted there is basically saying, do you want to change the recall month of these patients because they had their review in Q4, but their recall month is in Q1? So again, for those on the main web, the other webinar we did a couple of weeks ago, me as an example, my birthday's next month, so I'd probably be getting an invite now to come in for my review next month. But last year, maybe I was really, really lazy and I only came in February and had all my reviews done because I kept ignoring my invites, and eventually I was like, oh, I better go in and have my reviews. So I might have only just had my reviews in February, but because my birthday's in Q1, I'm now going to get another invite to say, come in for your review or your initial assessment. That report I would drop onto, and then as a practice, you could look at those patients and you go, well, Nathan probably won't want to come in. He only came in 2 months ago, 3 months ago. So let's move him and invite him in later in the year. So it just allows you to identify those patients and decide what you want to do with them. So that could help. I don't want to go through all of these now because we'd be here all day, but it's, again, this is when the support articles that we'll be able to provide you and the individual training, we can talk about all of these. So please don't worry if you don't, know all of this straight away. But we've got another report there that I've got highlighted, and it links back to those asthma patients I was talking about at the start. So that's basically saying, consider if review required. If not, you can record the default to follow-up code, or you could say you've got asthma resolved, because basically those patients on there have a diagnosis of asthma, but they have not been prescribed drugs in the last 12 months, and they don't have any other condition. So basically, they might not have ever come in before when you did your recalls if you were doing it off the asthma register, but they would be called in now. So what you can do is you could run those that report, look at those patients and go, well, actually, they probably don't have asthma, or let's review that patient, or actually, I don't want to deal with them now. So you can do what you want with them, but at least it will help you identify who they are. So again, that's just another useful one you can run. I mean, there's a couple of others around kind of epilepsy. So again, they might have epilepsy, but no other condition, and they might not have had drug therapy in the last 6 months. So again, you might think, well, let's just send them a questionnaire, or so you can deal, there's lots of things to help you to save you having to invite them in before you do your invites. So again, that just kind of helps you there. So I'm going to move on, but that's the example there. So that's kind of like the plan section. There is one setup one. This is more to do with if you've never used this system before, you can see if the codes that we use for the invites and the review done have been used previously. But for now, I wouldn't worry too much about that. So that could be something we could talk about individually if we train your practice. But the other ones I've shown you is just kind of planning ahead. We'll move on to the main bit now, the notify, because this is when you actually do your invites, and this is the majority of the time you're going to spend here. So you'll notice we've split them up. We've got first, second, third, but basically your first is where you do your invites. And basically in here, we've done that division. So we divided it by 12. And you can see there, look, it says for first invite in March, for April recall month, invite, then record the invite code. So an important thing, and a lot of people get confused with this, that says invite in March, that is your April births or recall months. So even though it says March, because it's always looking at the month ahead, so don't get too confused. It will always tell you at the top. So even though it says March, that's your April birthdays. April would be your May recall month and birthdays. May would be your June, etc. So it just goes through like that, but it's your division by 12 essentially. But in theory, that report there is everyone at your practice who has one of those conditions I showed you. They have not had an invite or a review yet, and they have a recall month of April, and you can run that and in theory invite them in. Before I tell you about that though, I'm just going to highlight those and run them just to get some numbers. Those patients there will include patients that just have asthma and no other condition. What you'll notice above here is you've got one which says notify asthma only. And in here, you've got all of them, or it's broken up by recall month. So for example, there you've got one for April. So that one is essentially any patient at your practice that has asthma, but no other condition. So I've got 69 there. Now, if I go back to my invites first, I've got 478. So 69 of that 478 have asthma and no other condition. So what you might want to do before you send those invites out is go to your asthma onlys and go to the April, and you might just want to bulk send them a questionnaire, because do you need to see them? Now, again, every practice is different, I appreciate, and you might do, but they haven't got any other condition. So you might think, well, actually, let's just deal with them first, get rid of them, for want of a better word, and then you could, in theory, get them to send their questionnaire back. Now, you might use AccuRx. I don't, so I can't show you that bit, but you could export that out and use AccuRx to send them that. Or on the right click and actions, you do have the option of using the communications annex. And if you use the communications annex, you will be able to select a questionnaire in there that we have built for you. Again, this will be on the support article as well, because I'm very conscious of time, because I could spend hours talking about all this, but the communications annex, and you could basically send them that questionnaire for them to fill out and send back into SystmOne, and that would code it as well. So we've got a nice little support guide that tells you how to do this, so please don't worry about remembering all for now. It's more just know it can do that. And in theory, as long as you then add the invite code, which I'll talk about in a minute, you could clear that 69. And if we did that on a Monday, we could send the questionnaires out, code the invite code. If you give it a day, because you have to wait for the reports to run overnight, because that invite code has been added, and again, I'll talk about the code in a minute, the next day that will be 0, because they've all had an invite and a questionnaire, the invite code and questionnaire. And what would happen is, if I then went to my invites first, that would be minus 69. So you wouldn't, 409, there you go. So there'd be 409 on there now, because you've sent those 69 a questionnaire. So it just allows you to clear those before you do any other invites. If you do that, just make sure you leave it a day between sending the questionnaire and then doing the rest of the invites. Now, then you could use these. Now, again, if you've done these before, if you're on my COVID webinar yesterday, the reports are all the same sort of concept. So you've got all, but then you've basically got things like, that's everyone, but we break it down. So you've got your consider methods. So for example, consider method is under 16. So those patients have one of those conditions that we looked at, but they are under 16. So you can run that, and I've only got 4. Look at those 4 patients and go, well, actually, I probably don't want to send them a generic invite, because it's going to go to their mum or their dad or their carer. So it just allows you to look at those patients before you invite them and do a more bespoke invite for them, because they might need it because they're under 16. So that's all it's doing. Same for the next one. Consider method as end of life, dementia, learning disability, reasonable adjustment. So those patients have one of those other conditions that we talked about at the start, but they also are either on the end of life register, have dementia, learning disability, or a reasonable adjustment. And again, we might want to look at those 10 patients and go, well, hang on a sec, we probably want to I probably can't send them a generic invite, because they might not be able to read it. They might not be able to read. They might not understand it. Do I need to send something to their carer? Do they need a review because they're on end of life? Does it need to be in large print? Look at those patients, decide what's going on with them, and then you can send an appropriate invite. So again, it just allows you to be a bit more nuanced with your invites, rather than just sending a generic invite to everyone. So those are just more sensitive patients. The majority of your patients are going to sit on this next one, which is electronic communications annex. What we do is we base these reports off of their preferred contact method. So this would basically allow them to look at, it basically looks at their preferred contact method, and if it's set as SMS, email, AirMid, or it's set as unknown, and they're not under 16 or have one of those end of life dementia things, because they're all mutually exclusive, these reports. So someone in that one will not be in that one, and someone in that one will not be in that one, etc. So the electronic communications annex report is, again, I always say this, for want of a better word, they are your normal patients. They won't need some sort of sensitive invite. You can just send them a generic invite. And the idea is, again, you could use the communications annex in SystmOne, and you could show the patients. I can't, because there's real patients in there. Or you could go to actions and go use communications annex, or you could use AccuRx. However you do it, you can do it. It shouldn't be any different. And you could invite them and send them a generic invite. And then the last two, you got letter and no communication. Letter will be if their preferred contact method is set as a letter. Now, it's worth noting, depending on how you work as a practice, you might not have made a concerted effort to set the preferred contact method, or SystmOne had many different ways of recording how people want to be contacted. You could code it. There was a place to put preferred. We've chosen preferred contact method because it's what the communications annex uses. So it's kind of like the up-to-date version of how to do that. If their preferred contact method is letter, they will sit there. It's still worth looking at those patients and see if they're using a mobile. And then you might decide as a practice, well, we still want to send a text, let's text them. That is totally up to you as practices. Obviously, it's not my place to say how you invite them. We're just going, look, they said they'd rather have a letter, but you might think, well, it's still cheaper to text them. Tough, they're getting a text, or we'll call them. So they still need an invite. You can decide how you want to invite them. Hopefully that would be less than that one, but it does depend how you work as a practice. And then the last one, no communication, is if they've set their preferred contact method as no communication, then they'll sit on there. Hopefully you'll have 0. If you do have patients on there, you just have to decide what to do with them. Like, you might look at them and go, oh, that's Bob. He doesn't like ever being contacted. Let's just deal with him this way. So again, how you deal with that's up to you. We're just highlighting that's what they've said, but they would still probably need a review or something doing to their notes. And that's how we divide them up, basically. And it's the same for every month. So using those, you can invite your patients in for that initial review. And the idea is it doesn't matter what condition they've got, because you can just come in for your initial review. You might want to send booking links as well. Again, you all have booking links set up for your appointments. That is an option. You can still have the option to do that. There's no right or wrong. We're just going, these patients need that invite. The most important thing, though, is you need to code this code at the top, the invite. Now, for those of you that have been using the LTC invites, you will notice that it's a different code to last year. Do not worry, we've updated it to this one because it's the most, it will help moving forward, especially with other things like NHS Notify and other codes. So it is the correct code. If you've used previous codes, do not worry. We have built into our reports those codes as well, so it will pick them up. Because I did see some comments the other day of people sending the invites out. They were using the code they used last year, and they noticed it changed, and they were worried that they weren't working. It will work. The reports will pick up that code. We're just saying from now on, use that code, because it will just make everything slicker, and you've just got one code you need to add. I will talk about the QoF invite codes later on, so please don't worry about that. But that code is integral, because that's how our process works. And it basically, as long as you add that code, and that's the same for those asthma ones. In theory, if I invited all 478 of those patients for their initial review, however I've done it, phone call, text, called them, as long as that's been coded, when I rerun that report tomorrow, that should say 0 if you've invited all of them and you've coded all of them. And then you just do that every month. Now, what will happen then is hopefully they'll book their appointment, and I'll go over the template in a minute and what's changed. But if they haven't, we're going to go to invite second. Now, we've made a slight change here. It's now 2 weeks. It used to be 3 weeks. It's now 2 weeks. But it tells you here, look, it says for second invite. The first invite was between 2 weeks and 3 months ago. So basically, if they've had that coded invite and they've not come in for their initial review or full-blown review, initial assessment, sorry, or full review, then after 2 weeks of you coding the invite, they'll drop onto this report, and you can basically just do the same again. You can send them a follow-up. You don't have to send it 2 weeks after you sent the first one. They're just going to drop onto that after 2 weeks, and you can start dealing with them then. So again, you can run those, same method, invite them in, and use the same invite code to say that you've sent them. These reports are clever. They'll look to see how many times that code's been added, basically. And then what will happen is they'll then move on to the third invite after another 2 weeks, and then you can send another follow-up. So it is nice, send the first, code it, 2 weeks later, send the second, code it, 2 weeks later, send the third and code it, unless they come in. So should make sense. Again, this is all on the support article as well. This invites to chase, we've just renamed this, but there's familiar reports. This is just reports that says if they've had the second invite, no, basically if they had the first invite and it was more than 3 months ago and they've not had a second invite, they'll sit on there, so you can chase those up. Same for that, they've had 2 invites, not had a third invite, and they've not had their review, chase that up. Or any patient that had 3 invites and it's been more than a month and they've not come in, you can use that as well. So again, you can just use those to chase up any invites that they haven't contacted you. And lastly, on the notify, you got your visits. Now, anyone in a care home or housebound are not included on those invites. They are sat here. So please don't worry, they don't get ignored, but these need to be run. So anyone in a care home or anyone coded as housebound will be sat here, and you can just basically run these off, give them to whoever does these. They will need a review. How you approach that is up to you, but obviously you can't invite them in because they're housebound or stuck in a care home. But they are identified. They all have one of those conditions, but they are coded as being housebound or a care home resident, so they don't get missed off. They're not on the invites, but they're sat there instead. So please don't forget about that one. Right, I'm going to go on to the template. I don't know if there's any questions that might be worth me, Stuart or Nicola.
The main question that keeps coming up is about the LTC code changing for the first invite. So you could just maybe explain that it's going to remain the same for now, and will it practices no?
Yeah, so if you've used that other code last year, like I said, the reports will still pick it up. Please don't worry. We've built the reports to pick that code up, so it shouldn't make any difference. We've just updated the code this year. I think we updated it last year as well, to be honest, from the year before. So it's but it should remain as that one now. And the reports are built to pick up the previous code, so please don't worry, you're not going to miss anything. We're just saying going forward, use this one. So hopefully that answers that.
Just another couple of questions really about breaking down the list of conditions.
Yes.
Report output as well.
So yes, we do have. It's really, I can't display it. So I should have mentioned it. Sorry, I can't show anyone this because I can't dive into the reports and show the patients. But there is a report output, and I think we've got a support article with this that we can send out to you with the recording, and it tells you exactly how to do this. So please don't worry. But when you see your list of patients, if you've ever done this, there is a button at the top that says select output, and one of the report outputs we've built for you is called LTC diagnosis, and it would be like QoF IF best practice, and that will basically refresh the screen, and you will have a list of every patient, but it will tell you what condition they've got. So then you could lump all your diabetics together and in theory send them an invite or send all your asthma or whatever. So it will allow you to do that. You can do everyone, or you can do it that way. Everyone works differently, but please don't worry. I can't show you this, but we've got some screenshots we can send out to you. And if you book individual training, we can show you how to do it on there as well. So it is possible, and it's done on a report output. But unfortunately, I can't show you because I can't look at patients. So, yeah. Stu.
The other question that's popped up just a couple of times, and to say is that yes, unfortunately, these do show patients that have appointments booked. We're not able to report in a way that can remove those.
Yeah. Thanks, Stu. Yeah, it is annoying. There's just everyone has different appointments, and you can't report on slot types. We don't know what slot types you've got. It's basically, as Stuart says, nigh on impossible for us to build reports to say if they've got an appointment. It's a shame, but there's no way around it. Sorry. In the past, I've always said to people on the second invites, usually. And people probably do this anyway. They usually put a sentence just to say, like, if you've recently booked your appointment, please ignore this. But yeah, there's no way around it, unfortunately. I wish there was, but there isn't. So sorry. Right. Wow, this has taken 45 minutes just to do that. Right. So let's jump into the template. We'll talk about this process and then we'll come back to the reports and show you what's changed there. But that's the most kind of wordy bit done, really. So I'm going to go to my patient. Now, a lot of you are probably used to the icon under the patient's name, which is the LTC, the long-term condition review template. And I always call it the goalkeeper, but it's like a green man in front of could be anything, but I think it looks like a goalkeeper. But I've done a lot of training. People have different words for it. Someone said it looks like someone skipping, but that icon will be on every single patient, and that is the long-term condition review template. Now, we have updated this template. This is brand new. At the moment, that is linking to the old one. I think as of tonight, there will be a link to the new one on this template. So you will see this as of tonight. There will be a button. So when you come in tomorrow, you'll see the button. You can see the new template. It is available to find if you at the bottom, if you type it in there, or if I press F12 on my keyboard and type LTC review. I mean, I've already got it on my left-hand side, but if you type LTC review, you will notice there's one that's literally called LTC review new. And I've added it, I've dragged it and put it on my favorites. As of tonight, the link will be on the button anyway. So please don't worry. I'm just doing it this way to show you now. So you can find it on the launcher, but we will have a link and eventually it will just be what comes up when you click that. So I'm going to double click. So none of you would have seen this yet, but these are just a few changes on here. Now, the front screen, it looks very similar, but it also doesn't. You'll see what I mean. So the homepage, the idea is, sorry, I should take a step back. Patients had their appointment. They're now going to come in and they're here for their initial appointment. And we're going to bring the template up. I'm going to go through the template anyway and then talk about that stage. So it's very similar, tabs across the top. There is the option on the front page now where you've got the choose LTC review month and default from follow up. So it used to be on the invitations tab, but you can do it from the front page. So at the start, I mentioned about changing the month the patient comes in. If you bring up the template when you're in the patient record and click the button in the bottom left, you've got the options on there. And literally you can tick the month to say, actually from May, and you just have to confirm your choice by using that code. And by doing that and clicking OK, that would then move that patient to being called in May. So it is as simple as that. And again, there are instructions on our help files to tell you how to do this. So please don't worry. It tells you on there. So that's basically on there. And then you've got the default from follow up. So if you click that, that will add that default from follow up code to stop them from getting an invite this year. So you can do that easily from there as well, but only if you don't want them to be called in. So there's those two buttons on that front page, basically. Now, I think a lot of these are very similar. The invitations tab is just going to show you what conditions the patient has. And on the right-hand side, you have the option. There used to be 3 buttons. We've now just created 1 button because it's smarter working. So if you wanted to invite the patient in ad hoc, or, I mean, you're going to do this in bulk, but if you wanted to code it individually, clicking that button will basically do that for you. So it'll add the invite codes and say that you've called them in. I imagine you do this in bulk anyway, but you can do that from there. So that's just slightly different to what was there before. But again, if I was a clinician, I'm probably not worried about this page. This is more just to see what invites have been sent, what conditions do they have. Same for the booking tab. It's no different to what you've currently done. It's showing me exactly what conditions the patient has. So if the patient called up and said, I've had a text, you can come here, see what they've got. And I've got links on the right hand side to either go to the appointment screen, or I could go to and do a free slot, which would be set up individually at your practices. But in theory, I can look at that and go, oh, I can see what you've got. Let me book you in with this HCA or to have that review, etc. So that's that page really. It just shows you what they've got, and it will show you any pending appointments. But again, those of you that currently use this, not really any different. It's the same sort of thing. Questionnaires tab, same place, no different. The only thing is we've got rid of all of the list. It was getting a bit messy, so you can just click the questionnaires button and they're all on there now. That enable you to do that. But in theory, if they filled out any questionnaires using SystmOne, you would be able to view those questionnaires on this page, basically. So again, and I would be able to right click and view the questionnaire or open it up and see what was coded and things like that if they have filled it out using SystmOne. But again, it's there if you need it, and it's no real different to what's gone before. The next two though are the key integral ones as part of this review. So the initial assessment tab is designed for that initial assessment. Makes sense. That's why it's called initial assessment. So if I'm the HCA, this is the page I'm going to. And you're going to notice, looks a bit different on the right-hand side. We've got rid of all of those buttons on the right-hand side, and we've got one button that takes you to an enhanced kind of initial assessment page where everything is on there instead. This is no different. This is the same as before. For those of you that have used this before, it's telling me what they've got. And then it tells me exactly what bloods are needed based off of the conditions that they've got. So we can see that, FBC is not done, HbA1c, LFTs, lipids, U's and E's. So I know those are the bloods that need to be done as part of their annual reviews. It also tells me that bloods they're on a DOAC, so I would also do these bloods for the DOAC as well. So it would incorporate bloods for medicines and things. And then it's also showing me that you need to do blood pressure, pulse, urine, and then like before, it also shows me the work to do. So what has not been done since the 1st of April, haven't done their BMI, smoking, lifestyle, depression, blood pressure, all of that. It's all the QOF stuff and best practice and what you would do as part of the review. The beauty of that is it updates in real time. So if you do any of that, it clears it. So if that was empty, there was no work to do, we know everything's been done. In the case of this patient, we know that none of it's been done yet. So all of that is the same as before. But rather than having to go to loads of different templates to do your tests and your lifestyle questions, everything is now done on this initial assessment and test button. So HCA, I can look at that. And if I click on this button, it will take me to the template. Now, again, it's quite similar to what was there before, but you get like a front screen. And what it's basically doing is these chevrons are by the pages that, in essence, have something that can be filled out based on what this patient has. And it's not saying they've got atrial fibrillation, hypertension. There might be some screening questions on there, and it will be obvious when you go to the page. So you'll see what I mean in a minute. At the bottom, there's the test page as well, which you'll notice is all across the top. So if I was the HCA doing the tests, I might go to the test page first or click that link. They do the same thing. And I'm going to go there just because you'll be familiar with this page. And it's no different. Shows you what bloods are requested are needed at the bottom. And then you've got the code. So, I can look at this and go, yeah, it's for chronic disease monitoring. I've got consent to do this. I've got the link there to ICE, so I can do my normal blood flow. I mean, it's no different to what you're currently doing. It's just a nice streamlined template with all of that in. I can code it as a blood sample, and it was, random. Even if there's complications and things like that, I can say, again, you would know what to put on here. You'll notice things are grayed out. So like ECG and spirometry do not need to be done because they're grayed out, whereas urine does. So again, I've got the drop down to say I've done the urine, or I can link to the urinalysis template there. So it's no different. If you're using this already, it's exactly the same, but it's just all in one place. So that page allows you to do the bloods. But you'll notice another thing we've done is we've grayed out tabs that aren't relevant. So I know I said on the home page, the chevrons, but also I can't click on some of these because they don't have COPD. So I don't need to go there. So it only lights up what I need to do. But lifestyle, click there or there. Same as before, all your lifestyle questions. So there was a separate button that you had to click on to do all these. It's all on here now. So we can just go here and fill all this out and do my screening. I am just doing this quickly just to show you, do they smoke? You can get all of these questions, there and then. as much as you can. And again, this all depends on your workflow and your skill sets, but the idea is you could try and get as much done as possible on that initial assessment, and the template's going to aid you because it's telling you what to capture. So you could do all of that. I know I'm being quick, but you get the idea. You can fill those out. And then each page, so for example, here, like I said, they don't have atrial fibrillation, but as part of their conditions, we would probably do some screening. So it's telling you it's screening for atrial fibrillation. So I can put like the heart rate in there and the pulse, and it even tells me exactly what the high kind of alert things would be, for an urgent GP review, if it's this, and if I put the blood pressure in, what's bad and what's good. So it's giving me that guidance, and I can tick as appropriate, so I can do that screening. And you can kind of just go through the template and fill out. Now on the cardiovascular page, I don't need to do this because it's not relevant for the patient. So anything not relevant for the patient will be grayed out. So in this case, it would just be a case of maybe doing like, your initial assessment for cardiovascular disease, and, you might have to do a QRIS score and that sort of thing. So that would be on there. They have got heart failure. So there's some basic kind of screening questions there that I would be able to ask them as part of the consultation. And again, it's flagging up anything that I'd need to be worried about. Diabetes, again, foot check. Anything else that I need to do is all on there. I mean, have a play with this because it's really good. Asthma questions. They've got asthma. They've got all of these conditions, which is why they're lit up. If they didn't, it would be grayed out. So asthma, asthma control test. A lot of this would have been filled out on the questionnaire, maybe. So again, the other thing to say is all of this, if they've already got it filled out, you're going to see it on the right-hand side. So you'll be able to click on it, go, well, they've already filled this out. I don't need to do it again. So you don't need to duplicate anything on this template. Once it's filled out once, it's on there. And then those I don't need. Mental health. Look, they don't have an SMI, which is why that's grayed out, but you might just ask them about, if you've got normal, how you feeling, and you've got the ability to do that there. So it might feel like there's lots on there, but it will show you what you need to fill out, and it will be linked to kind of what you currently do anyway. And it's just helping you doing that screening based on, what you would normally ask. So rather than before, there were lots of buttons that you had to go in and out of, it's all in one place and you can just go across the top. And then once you've done that, and you've done your initial assessments, you might do your bloods, go through that initial assessment. We're just going to tick this initial assessment done tick box. And in theory, I've done the bloods, done everything. I'm going to send the patient on their way. And by ticking that, it's going to remove the patient from the invite reports. I appreciate I'm running over time now. It's quite a lot to show, really. So apologies, I'll go a bit over, but this is recorded if you have to drop off, so please don't worry. So by doing that, I would save the record. And what we're going to do is we're going to go back to our reports, and we're going to move on to like the assessment. Well, you've got the review section really, because they've had their assessments done. So in this review section, if I go to review all, basically what happens is after they've had their initial assessment, 3 days later, they will drop onto these reports. And the idea is that will give time for the bloods to come back. So then I can review the bloods and I can do a notes review. I can see what did the HCA do? Was everything asked? Is there anything else I need to follow up on? And so I could run that top one, which is everyone. Or we've broken it down. So all of your cardiovascular, renal and metabolic patients, or everyone that has heart failure or hypertension. All is everyone. This just breaks it down by the different conditions. So depending on your skill sets, I'm just going to deal with the, hypertension patients that had their initial review first and make sure they're all okay and check their bloods. So all of the patients on here are on there because that initial assessment done tick box was ticked. So you can use all, but what we've done is, and this is new, this is no different. We had this before, but what we've done is we've actually got these where a separate folder now which says only has one long-term condition. So for example, they only have atrial fibrillation, they only have CHD, they only have diabetes or heart failure, or so again just allows you to kind of clear those guys off because they should be less complex because they've only got one condition. So you could do it that way, or we've grouped them. So again, depending on your skill sets and you might have specialists who deal with your mental health patients or your respiratory patients or your cardiovascular and renal metabolic patients. So that would divide them up like that. They are obviously all overlapping. We just give you those abilities to look at those and decide how you want to approach and do that notes review. They've had their initial assessment. What else do I need to do? And by using those, you would be able to go back to the template. So I'm going to go back on F12. Obviously, it would be the icon under the name. And we're going to go to our review tab. So again, the main view is no different. The only thing now is it's not telling me what bloods are needed. If I scroll to the bottom, I'll have a table of all their blood results. So I'll be able to see at a glance what were their blood results that have come back. And I might have looked at them already, but I can see them at a glance. You would be able to see all of their work, their well-being. Now, so I forgot to show this in the last one because I was getting too excited about the template, but all of this will clear. So if all of this has been done, it won't be on there anymore. So I'll be able to go, what is the HCA done everything? Are the bloods fine? Happy days. And if that's the case, we could just text the patient. This is an ideal world, by the way. We could text the patient. So you've got the ability where it says follow up. If you click follow up, then we could send them a text message or something like that on there. So you've got the ability to do that, or we can send a task to someone to say, can you let the patient know? So again, it just allows you to kind of, I guess, yeah, fine, see you later. Obviously, some patients will need more doing to them. That is just the best case scenario. So again, we can use this template either with the patient, without the patient, over the phone, however you want to use it. But because it's got all that information in front of you, what again you'll notice is rather than having a button for each condition, we've grouped them again. So you've got your lifestyle at the top if there's anything else to do with lifestyle questions. But what's different now is we've got your cardiovascular conditions, respiratory, mental health, and other. Now, again, it will grey out anything the patient doesn't have. So I know there's cardiovascular, renal, and metabolic, and respiratory stuff I need to look at. So if I do the first one, then it's everything in one template again. So it's kind of no different to what you're doing originally, but it just goes in like this. Rather than going to individual templates, you've got everything in one. So it's telling me to look at the screening page, the cardiovascular disease primary prevention page, heart failure, diabetes, and CKD, because that's all of the conditions this patient has or would need screening for. And again, go to the page, and it will pull through heart rates and things, but it's telling me it's got this like traffic light system. Is it normal? Is it irregular? Hypertension, is it normal? Is it irregular? So we can code our reviews on here. Red stars are quaff. Anything grayed out is not applicable for the patient. And then again, I can't click on those tabs, but I can go to this tab, and I could do like the Q risk, make sure all that's recorded. Obviously, if anything's been recorded already, it's going to put it through. I can go to the heart failure page. You've got all of your questions. You can say you're doing your heart failure review, and from the questions, is it poorly controlled? This is the management. I don't want to go through every option on here because you kind of need to play with this and stuff. It's more just showing you how it's laid out, really. Diabetes tab, go through the assessment. You've got all of the ability to do your full-blown diabetes review. CKD, and I think that's it for that one. So all it's doing is it's lumping those conditions into one template, so you don't have to go into all the different review templates. It's all in one place, and then you would just kind of okay that. And then we need to do respiratory, and I bet you on this one it should be nice and simple because it's telling me they're over 16, so it's asthma over 16, and you've got your standard asthma review where the red stars are quaff. You can get your ACT score, inhaler technique, exacerbations, etc. So again, it's no different to how you're currently using this. It's just enabling you to do your reviews. So that's the biggest change, is rather than individual buttons, we've just grouped them on a bigger kind of template. And again, have a play. If you look for it on F12 for now, but there will be a link to it from tomorrow on the main LTC template. Now, the other change here is, now originally what we would say is once you've done everything and you're happy, you would tick the annual review completed tick box to say everything's been done. That's a bit like your recall, and it kind of moves them on till next year. So, see you next year. That still does that. We've introduced this button here, which says LTC annual review, which you might think, completes everything. But it was always a thing when I did the training for this. People always say, well, what if I do my bit, but I've got another I'm still waiting on something, or another clinician needs to look at this. This would basically tick it to say, well, I've done my bit, but it doesn't complete it, and it moves it to another report. So this is new. So this kind of puts it into a holding ground. You kind of use it how you want, but it's a really nice way now of saying, well, I've done everything I can do, but someone else still needs to follow this up. So by ticking that, so if you click completed, it just clears it. That's done for the year. But this one, if I tick that and click OK, I'm going to cancel that, but that you'd click OK. Back in our reporting, you've got here, look, review to complete. So this is where someone's ticked that box. They would drop onto this report. So it's almost like another stage, which we didn't do this before. This is new. So how you use that is up to you, but it allows you to say, like, it's almost like kind of partially completed, and then they'll get dropped onto these reports. And they are the same format. You can do all or by disease, or they only have one of them, or one in a group. So again, it just allows you to kind of divide it and look at it like that if you so wish. You might not use it, you don't have to, but it's just another option that we've provided you that might actually make this process slicker. And again, it's the sort of thing we can look at if we do training for you and things like that. I'm conscious I'm running out of time. I'm hoping this is making sense. But in essence, just take a step back. HCA does the initial review on the initial assessment page, gathers as much information as they need or can. They tick the initial assessment box. Someone then looks at the review reports, does a notes review, decides if they want to call the patient in, uses that page and those templates like I showed you, and then they either complete everything or say it's partially completed, and then they can complete everything on those review to complete ones if they have done that. And in theory, once everything's been completed, they'll drop off the reports until next year. And that is essentially the process. It's very hard to kind of, I think it's really good to do book training and stuff, and I'll talk about it at the end. And then just kind of to wrap up this bit, there's just some evaluate reports where we've got evaluate activity last month. And it would just give you an example of like reviews completed last month, any, default for follow-ups coded last month, DNAs, how many initial assessments were done, and invites that were sent. And then you can do the same information for the fiscal year as well, so you can see how you're doing with this and all of that data, if that makes sense. I appreciate it's quite a lot that I've gone through there. Are there any questions, Stuart or Nicola, that might be worth me highlighting?
For me, it's just people asking how they can book training, really.
Oh, yeah, cool. I'll move on to that.
There might be something else from Stuart or James, I'm not sure.
Do you have any, Stu? If you don't.
I don't have any new specific ones. No.
Oh, happy days. Okay, cool. So I appreciate that's a lot, and it's more. Some of you using it already, so I'm hoping it's made sense, because it's no real difference what you're doing, but you can see some enhancements, and those templates are different, but they flow the same way. They're actually a bit slicker, so once you get used to them. So have a look at it. On there, it's your training and sport. So we're going to do a bi-monthly walkthrough webinar on this. So if you we might tweak it as well, because we want your feedback. I'll do a slide in a minute. So if you've got any feedback, let us know, because there might be things about it you're like, oh, on that template, it'd be really good if you had a button here and there. So, we do want that feedback. Appreciate those templates aren't available yet, so you haven't played with them. So it's almost good for you to have a play. But yeah, we're going to be doing some targeted practice level training as well. So we'll probably be emailing out areas to say, would you like some training on this? But if you do want any of this now, do email us at training@ardens.org.uk and we can get some training booked in. And it's a really nice thing because we can just chat to you and we can talk about how you work, and it should hopefully make sense once we've gone through it like that. And don't forget the support articles and the support desk as well. So support@ardens.org.uk just for general support about all of this. So yeah, that's all on there.
Can I just quickly ask Nathan, only because the last kind of 3 questions is just about QOF invite codes.
Oh yes, good point. Thank you. Sorry, I did.
That's okay.
So we don't. Let me come out this a second. I will go back to this screen. Don't worry. As part of the process, we don't get you to add the QoF invite code. And the reason we do that is because in SystmOne, obviously, as you know, when you add 2, it adds the automatic personalized care adjustment code to those patients' records, and it clears their QoF work to do. And the idea being is, again, I'll use me as an example. If I ignored all my invites and you invite me more than once and you add the QoF invite code, my work to do disappears from my front screen. I might come in December for something else, and it won't be obvious I've got outstanding diabetes work, for example, because I'm only in a 10-minute appointment and the nurse probably doesn't have time to look at that because they're doing a million and one other things. And therefore, they could have got my QoF but didn't because those alerts were missing. So, and the other thing is, it makes it a bit faffier because you have to add another code and doesn't do it all this way. So we don't encourage people. It's not to say you can't, you can still add it if you want. There's nothing stopping you from doing it. We just don't tell you to do it. What we've done is we've built some reports to help you with this that you can run towards the end of the year. They are in a separate folder. Again, this is all going to be on the support article and everything. So please don't worry if you don't remember this now. There is a folder. We're currently on last year's 25-26. There will be one for 26-27, but I appreciate it's only 9 days into April, so you wouldn't need them yet anyway. But in this folder, 25-26 QoF, if we open this up, there is one called invites, a subfolder. Say this is on the support article, so it tells you how to do this. And all of those reports I've just highlighted are if you are using our LTC system to send invites. They will basically, so for example, that one is any patient that has asthma, has had an invite using the invite code that I showed you that we use, and they still have outstanding QoF. And what you could do is you could look at those 6 patients and go, why is their QoF still outstanding? When were they invited? And then you could basically backdate the invite code that we tell you there, which is the QoF invite code. And then if you do the same again for everyone that's had that one there is basically anyone that's had 2 invites using our system, you could look at those and you could backdate the code again. And at that point, it's automatically going to add that personalized care adjustment code. So basically, you can retrospectively do it towards the end of the year if you wanted to. And I guess if you do it that way, you're going to have less patients on there because if you did this in the last quarter, anyone left with outstanding QoF work probably just haven't come in. So you can do it then rather than do it to everyone at the start of the year. So it will do the same thing, but you can do it retrospectively. So we have those reports to help you with that. And that's just asthma. Can you see it's for each one? So we've put the code on each one. So you could use that to add the QoF invite code at a later date to then do that personalized care adjustment. So that's how we've done it. If you want to do it as part of the process, you can just add the code after you've added our invite code. There's no right or wrong. We just give you that option. So I hope that makes sense. As I say, there's loads of support articles that we'll be sending out that will highlight this as well. So don't worry. Yeah, I'll bring up the other page. Hopefully that will make sense. There you go. So there's that one. And then I'll leave that there. And then what I'll do is I'll do the next slides. Hopefully you've all got, we can put the email addresses in the Q&A as well. So if we just leave that. So if you've got any feedback just on the resources or anything at all, do scan that. If there's anything, you like about it or don't like or whatever, let us know, because we want that feedback to see how this works. And, I appreciate there's a lot there. But hopefully it's given you an idea of, those that are currently using it, what's changed. And I say the process is pretty much the same. We've just enhanced the template really and renamed the folders. But everything else is, the same. So yeah, I might wrap up there. If anyone's got any other questions, let me know. Other than that, thanks for your time, and I'll speak to you soon.